is a clinician, okay, who, who is a clinician and music therapist who serves the West Michigan area. Right now, he is working in juvenile justice with the young people, but he does provide treatment services for individuals of many ages. That's why he's here with us this morning. As well as he does a lot of professional development for individual agencies and has presented as a clinician at many conferences, including the Gilmore Keyboard Festival and at Michigan State and many others. So welcome, Louis. We'll be anxious to hear about music therapy.
All right. So it's a joy to be here, and I appreciate this nice big group. It's been a while since I've had a nice full Zoom room. So yeah, how do you do, Phyllis and Ben and Karen and Donna, Mr. iPad 5, Kathleen and Robert and Kathy and Jody and Karen, and owner Ruth Lindholm. All right. So as Lynn was saying, I am currently a music therapist serving our West Michigan community in the realm of juvenile justice. And I thought that this would be an opportunity. First of all, I think that the HASP program where, you know, the learning just continues. But I was impressed when Lynn described why, you know, uh, you guys would benefit from a music therapy presentation, and to see people joining up just says, like, I love that the learning can continue in any kind of programming. So I have a presentation that will guide us through what music therapy is, some of the different settings that music therapy is applied, and hopefully we can take questions and comments and maybe even make a little music ourselves along the way here in the Zoom room. But first off, just a visual check. I don't know if everybody see my presentation like this. I didn't do the screen share. I could, if we would prefer, or we could just pin the video.
I can see it.
Yeah, I can see it.
Okay, yep. So, yeah, I thought that it would be nice to start off with a little music. Music therapists often start off with some form of greeting song to begin a session, which will frame what learning will take place. And also just get everybody oriented to the session. So I have some genres of music up here. We've got reggae, rap music, pop music, folk, um, campfire music, rock and roll, jazz, or metal. I was wondering if somebody would like to either say out loud or say in the chat, what genre of music should our greeting hello song be today? And I'll just wait a moment for that.
I
Rock
like
and
it.
roll.
Yeah, rock and roll.
Rock and roll, I like it. So I am going to show you the messy area that is my full computer screen, and I'll put you guys off here for a little bit. A big part of modern music therapy is being able to operate a recording studio. Whether it's in the hospital where you may have young people that are going to be staying in the hospital for an extended period of time, maybe 3 or 4 months, or even 2 or 3 weeks, or students in school that you're trying to teach concepts to, if you can make a recording, they can take that home with them and remember the growth that they had, maybe even allow their learning to continue. So I thought we would take a creative risk today and see if we can make a hello song right to get us started, and rock and roll will be the way. So I like to make sure to take an opportunity to give kids exposure to different cultures. We wouldn't be where we are with music without all of the cultures of the world. European culture, or classical music, as they say, it's it has a big role in how we listen to music. But boy, if we didn't have that music from Africa bringing us music like rock and roll and the blues, or soul music, or jazz music, then boy, it'd be a little bit dry these days. So, what continent would we like to go to? I've got Africa, South America, or Asia for our percussion today.
Africa, I think.
All right. So, here we are with some African percussion. And I'll switch this over to the jam cam. This is something that we've been using a little bit more since we've gone virtual. Am I? Here I am.
Yeah.
Hello.
Yeah.
All right. So let's see. All right. Switching back here, we are going to take that little recording that we made, and now we've got some African percussion. And one thing I love to show with the kids, because I can have them interface with this and record music. Now it starts over, so we go. Oh, do we have a question? I can turn down the drums if somebody had a question. Okay.
Nope, I think someone was muted accidentally.
Okay, no problem. So one thing I like to show the kids is that music education, like knowing how to play music, isn't something reserved just for people that take classes or learn how to read the notation. So if they play something like this and we record it, I can very quickly just show them that they make complex music right, you know, off of the top of their head. So it isn't about the notation, the little black dots of music that makes it special. It's what comes out in our expression of music. So this is sounding pretty good. It's seeming kind of a good tempo. I think maybe we could add a little bit of guitar. Now you guys said rock and roll, so I'm thinking that we need a nice rockin' guitar. And I was telling Lynn, this guitar has been with me since I was 16 years old. I like to tell the kids the story of it, because back then you could get a job at 14. I saved up all of my money from the time I was 14 until 16 and bought this guitar. And it's still the one that goes to work. Although I have many, it's still the one that goes to work with me every day. So let's see. I don't know if that sounds rockin' enough. Let's see if we can maybe like... That sounded kind of rockin'. Thumbs up if somebody thinks that sounds rockin'. All right. Shout out Brenda. That's the first thumbs up I saw. All right, so let's see. Here we go. Here we go. That sounds like a clip right there. We'll set the guitar aside, come back here, and hopefully this isn't too jostling for everybody jumping around screens, but trying to make an immersive learning experience here with our Zoom. And this has been the way I've found to do it since the pandemic began. All right, taking a listen. Maybe we should add a little bass line in there. Let's find some bass in here. Okay, this is kind of a funkier bass than I think I would want to use, but it's here, so we're going to go with it. Yeah, the Michael Jackson bass is what we call this at school. we've got the start of a beautiful little hello song, and I've got a couple different things that I'd love to say to you guys, but who would be willing to say something about hasp so that we could make a chorus maybe that celebrates us in this group that we've formed, in this rock band that we've formed. I don't know. What do you think, Jody? Are we a rock band? I think so. All right. Any ideas? What makes hasp great? I'm just waiting just a second.
I think that hasp is awesome for allowing people to continue to groove with the music of their soul and their life and not give up and keep on rolling.
Keeps our soul grooving. Keeps our so HASP, keeps our soul grooving. All right, I like that. And then we just need one more comment. So we've got keeps our soul grooving, HASP. If it rhymes with the letter P, that would be even better, I think. Oh, I think Lynn, I see the gears turning.
Yeah. I was thinking of something that about has being a place where you can meet people with like, and so like interests or experience new things. So I was trying to go P and me, but I can't get the words right between the sound of P and me.
Oh, sounds good. Now I'm going to take that awesome idea and turn it a little bit into a social idea here.
Sure.
So we're going to say, I like you and you like me. If I were in a classroom with students that are having trouble maybe being nice to one another or maybe being shy to learn from one another, I'm not saying that's this class in our HASP group, but many classes I work in, feel that kind of way, maybe stay to themselves because it feels safer. So let's say when we get to that part of the song, I like you and you like me, everybody just tries to point at somebody in the Hollywood squares of our Zoom. Just pick somebody, point at them, and then point at yourself. I like you, you like me. And I'm going to type that in here. And I'm going to repeat the chorus. Do a little copy and paste. Okay. I don't know how it's all going to line up with our song, but I'm just going to hit play and we're just going to go for it. So here's our presentation. I've got some lyrics. We've selected our song style as rock. Let's do a little intro on our music. Let's see. All right, we'll do a 4-bar intro. Ladies and gentlemen of the HASP group, are you ready to rock this hello song? 3, 2, 1. Welcome, everybody. So glad you're here. Got this little bitty song to warm up all your ears. Took up a mission cause we want all people winning. We make the world better, music in it. Unity is central to realizing dreams, and the futures they be brighter when we participate up in this room. We are elevating, climbing higher is the difference in the world we see. Work we do it ain't all sunshine and rainbows. Our youth finding roots, stay blowing with the wind. Though mighty people may have much stress on their mind, but they know how to respond and how to spend their time. My name is Louis, like my great granddaddy to my son. Wake up in the morning, working smart and having fun. Hope College, shout out Hope College. That's where the kids go to get the knowledge. Hope College, shout out Hope College. Where the kids go to get the little knowledge. Gonna drop a little chorus for we about to begin. Everybody I see in this room is gonna win. Here comes the part we're gonna point at our friends. Alright, here we go. HASP. P. Like you and you like me. H-A-S-P. I like you and you like. One more time. H-A-S-P. I like you and you like me. H-A-S-P. And I like you. You kind of like me. I don't know if you really like me yet, but I think you get the idea of where we're going with this situation. I'm gonna just fade this little music away. Some music ends with a good little fade away. There it goes. Rockin' Hasp Hello Song. Rockin' Hasp Hello Song. All right. Thank you guys for helping write that song. Can you believe that song never existed until we just made it happen here today? I did not know what it was going to turn out like, but I'm really glad that we made the choices that we decided to make. Looks like we got some new folks joining us. Ooh, we got 2 pages of Zoom people. I love it. You love to see it, honestly. A lot of participation. All right, so I don't know if you caught that, but I am Louis Moran the Fourth. So my name is Louis, like my great granddaddy to my son, Louis the Fifth. So shout out to all the Louis in there. I don't know if we have any Louis. We have an Alda though. Hello, Alda. Keeps our soul grooving. Oh, we forgot that part. All right. So this is where the information part can kind of come. Oh wait, here we go. I meant to show this picture as I was saying that, but yeah, there's Louis, my great granddaddy to my son. Shout out to the Louis. And this is the part where we could give a little bit of information about what is music therapy. So this is the definition from our National Music Therapy Association, the American Music Therapy Association, AMTA. And it's got to be challenging to try to make a definition that captures everybody and everything that music therapists do. But this has been the definition for a while, and that it's music therapy is clinical and evidence-based. We use music interventions to accomplish goals that are non-musical. These goals have to be by a credentialed professional. So we take a board certification exam after we are done with our education, and we have to, of course, complete an approved national music therapy program at a college or university. I don't think Hope has a music therapy program yet, but an interesting point is that music therapy was begun in World War II by nurses that were treating veterans, both on and off the battlefield. And they noticed that music could have a healing effect for their soldiers that were injured. So the pain mediation was something that they noticed that music could help with. And they also noticed that anxieties and general mood could be improved if they were to apply some structured music. Interestingly enough, those nurses came over and communicated with some doctors in America, and Michigan State University in 1942 had the first music therapy program in a university in the whole entire world. So Michigan has a deep history with music therapy, and I always thought I would give a shout out, if we can out there. So you can see some of the non-musical goals. I'll see if I can make this a little bit bigger. Let's see. How does it look if I do this? Does that look better, Lynn?
Yeah, that's good.
Okay, cool. So promoting wellness is one area that music therapy might help, and specifically targeting things that help us manage our stress, alleviate pain, express our feelings. In the realm of service that involves patients who have experienced a stroke or patients who might be experiencing Alzheimer's and dementia, enhancing memory, music has, and we'll watch a little video that I think explains things better than I do, but music can really trigger memories in a deep and meaningful way that has us rise above whatever physical and neurologic brain limitations we might have at a certain age and ability. Using music to improve communication, promote physical rehabilitation, and I like that they add "and more," because there's no way really to put all of the things that music therapists are doing in one definition. So I thought I would, let's zoom this back out a little bit. I thought I would show some pictures of music therapists that are working in both, not just the hospital setting, but if you look into the bottom right, that's actually this tiny little baby with the pacifier. That baby was born quite premature. And music therapy in the neonatal intensive care unit has some incredible research. I've never had the pleasure to work in that setting, but thankfully, as a music therapist, they give us a lot of experiences. So, working, and I have worked in hospitals, and my placement in a hospital was in child oncology. So, helping kids who are undergoing cancer treatments of various types. So, music therapists that work in the hospital setting might work to help alleviate pain. This big picture with the music therapist who has a guitar and the young person with the drum on their head, that young person was waiting to have a painful procedure, actually a spinal tap. And the music therapist coming in early, engaging in some musical play, but then continuing the music making while the procedure is taking place can not only help reduce the pain perception that somebody might be experiencing, but sometimes distract them altogether from the procedure that's taking place. And if there's one thing I've learned about working with kids who are in a child oncology, those are some tough kids. They are not often long to be scared of large needles and everything, but still it's an invasive thing that can be, difficult to experience day after day after day. So music therapy being used to actually alleviate pain and also distract from painful procedures. We can only we can only actually fit so much pleasure and pain into our brain. It goes through the same tunnel. So if enough pleasurable experience is being experienced by the brain, not as much pain can literally go through. It's a theory from the 1960s, which uh, I guess unfortunately they have no better research. And this isn't music therapy specific. You notice that they've been using smiley faces, kind of like this, smiley faces on how are you feeling today for literally since the 1960s. And if you go to a doctor's office today that works with kids, you're going to see the smiley faces. It's the best we've got so far with understanding pain. One final, if anybody has any questions about music therapy in the hospital setting, feel free to type them in the chat or just, you can, if you wave your hand like this, I will see it. Let me make my Zoom. Let me see if I can catch 2 pages worth of Zoom, folks, so I don't miss anybody.
So Louis,
Yes.
Susan, I didn't meet you at the beginning. Let me camera here. Typically we have questions go directly into the chat. So I just undid that and made it so that all chat questions will go publicly.
I love that.
Everybody in the house classroom that normally thinks that they're just going to get screened by me, for this rad presentation, we're going to let you just directly talk to Louis because he knows what he's doing.
Yeah,
He
yeah.
this morning.
Oh, no, oh well, hey, we're just trying to keep this ship a sailing, right? So yeah, any questions? It's just we'll just keep going and going. But I did want to make a mention of this young person right here, this young individual. So in the neonatal intensive care unit, it can be a scary and challenging time for the parents. I think that maybe we have people who have experienced that in our group right now and relate with those feelings. Note the most one of the most important things is to make sure that respiration and breathing and blood oxygen levels are where they should be, and also the idea of helping this young person learn how to eat. They're cut off early from being in the womb and have less of that opportunity to grow in that way and may not be physically ready to have the have the nutritive sucking that they would need to either have a bottle or food from mom. So notice that on this baby's pacifier is a blue device. And this is to teach this baby actually how to engage in non-nutritive sucking so that they know how to eat. And whenever they suck on the pacifier, so the music from that speaker right behind them will play. And when they stop sucking, the music will stop.
Hmm.
So it triggers that if their interest is to, if the music is engaging for them, they'll quickly learn. And we know how quickly babies learn, way quicker than we do. You know what I mean? 95% of their learning is going to happen in the first 5 years in certain ways. And this is one of those ways to specifically use music for a non-musical purpose in the hospital setting. There are So I just think that's really neat. And also with the presentation of music, so they may hold, the neonate, the young little baby, and there's certain techniques that the music therapist will do with singing certain syllables and touching the baby's head and stimulating every part of their face, of course, with gloves on, especially these days, and all the way from their head down to their toes. And you actually can literally watch their blood oxygen levels go to the levels that you want to see as the intervention is taking place. Very, very interesting realm of music therapy research. And very successful too, and has been for a number of years. Um, this is not a new application of music therapy in the hospital setting. All right. Does anybody have any questions on that? All right. Seems good. And for those that are just joining a little bit late, my name is Louie, and I am a music therapist that works in West Michigan, specifically with the school-aged population. So, not to be too, you know, I don't know if this I don't know how this comment feels, but they often say that music therapy is a cradle to the grave profession, because we have literally the youngest humans that we were just talking about, all the way to our elders who may be in assisted living or may at the very end be in hospice. So music therapy can be applied at every step of human development, from the time we're born, even if it's very early, all the way to the time that we, will be leaving this earth, hopefully for better, things, of course. So this is an example of some music therapists working in both assisted living facilities and working. This big picture here on the right are members of a group that is for men who have Parkinson's disease. Now, another very interesting aspect of music is that we can't deny it. When I clap in this microphone, just like this, now I apologize if that was a little bit loud for everybody, but that sound traveled into all of our brains. And there was actually a literal, so if I actually pull up, I can demonstrate this. If we pull up the old recording studio, and I won't do the clap this time, I'll do a snap. How does that sound? And I'm going to solo this. Let's mute that microphone. And we've got it coming through. Hello. And I'm going to go. So you can see that snap sound that I made right here. And if I stretch that sound out, we can take it down to the milliseconds. There we go. So I don't know how clear it looks on your end, but you should see a waveform. And when you take it down this stretched out, you can actually see the different parts of that sound. The high point, which is where most of us hear a snap, and then the decay of the sound that happens afterwards. Well, the human brain hears a sound and almost exactly 300 milliseconds. So just this far away. See if I can get the waves sitting next to each other. I'm going to make this one yellow so we know that it's a different wave. About 300 milliseconds after a sound is played is when our brain will have a wave that looks just like this one, which is a pretty interesting thing about how we hear. It's called the P300 response, which means that 300 milliseconds after a sound, our brain is stimulated, whether we act on it or not, or whether we're awake or not. These different kind of stimulation can happen even when we're asleep. Well, as research has found, this response of catering to our brain's natural detection of sounds and processing waves can be used to help organize people's body. So, stimulating music, or in this case, the music therapist is using an electronic guitar that she has on her lap, which can make sounds that go. I'll see if I can demonstrate something, but it almost sounds like a harp. It would be like, and then as she strums it down, now the pitch of that is also a stimulating part, and you can see these individuals in the group here are actually raising their hand following the music, which stimulates new neurological connections and helps build the rehabilitation potential for folks that are, have experienced a traumatic brain injury, Huntington's disease. In this case, it's Parkinson's disease that these individuals are experiencing, and can be a very big help in the physical rehabilitation. So I thought I would show an example. Does anybody have any questions at this point? Feel free to put them in the chat, or I love questions along the way so that we don't have to say, remember we were talking about, assisted living or the P300. It's nice to have them in real time if you would like.
Louis, I think Ben has a question.
Okay, sure. Ben.
Louis, somewhat related. And this is
Yes.
kind of ties in the whole the definition of music therapy and the purposes behind HASP. So not to the extent of someone who's suffering from Parkinson's or a stroke or whatever, but trying to understand the science between retirement and looking for a purpose in life, and the science behind our interest in creating that second life where we take on new interest, like a musical instrument and
Okay.
playing music. So it's a kind of therapy. It's not a formal therapy, but it's responding to a need in terms of belonging and finding purpose, and it's in music. So can you relate that to music therapy and extend, if not the definition, the application?
Sure. So if I'm hearing your meaning, Ben, are you saying that HASP provides new opportunities for the participants to have what you call the second life, and gain new interests and passions? And you want me to connect that to how music therapy is used outside or inside of HASP?
Well, probably outside. I mean,
Okay.
HASP does a lot of that non-music, although things like this incorporate music. But the idea of in retirement, when you give up your first life, whatever your passion or whatever your profession
Sure.
was, and you do something completely different in your second life, i.e., pursue what you could call them hobbies, or you could call them a second life. And
Sure.
when you choose music as one of those areas of interest, it's providing a form of therapy in terms of responding to your needs. I mean, they're not necessarily physical, but they're mental, and a need to
Sure.
belong and to have a purpose in life. So I'm just trying to kind of make that connection that's
Sure.
relevant to many of us as we have moved through or in retirement, and finding a purpose that may be in music, and it's a kind of informal music therapy.
Gotcha. I was speaking, I think, with Kim. It may have been Lynn too. It was Kim at the beginning about this, our present situation in the technology generation. And I mean, I see a group of people, you described as, looking at retirement or maybe already there, and yet here we are connected on a video chat that was in like Star Trek or something like that. So I hope that, and when you say, the belonging and things, I hear wellness. I hear an overall, like an overall need and desire, and something that we all deserve in retirement is to have new things and wellness.
Right.
So in this technology age, I would recommend, and I'll and I can put these in a follow up to Lynn too. I would always recommend ukulele. If you've ever wanted to learn guitar and you're feeling like, oh, I don't know about that kind of thing, ukuleles are affordable, easier to play, like easier on your fingers. So like I can already tell, ways that I've abused my hands and whatnot, but like they're very easy to press down, and you can play a million songs after, if you're dedicated for a whole month, you're going to come out of that knowing some things to do. There's also different kinds of groups. I'll go back to this picture here. So this is a group. I think I might need to move her to the front. Front. This is a social group where they learn about different cultures of the world, and the music therapist brings in the different cultures. At this particular session, they were talking about Native American music. And it was during what we call Thanksgiving time, but also trying to learn new social things like about Christopher Columbus, for example. Like, do we want to teach the current things that are going on and like what we've learned from history to our elders? Even though we've learned something a certain way in 1940, sometimes things change. So that's what this music therapist was doing in this present situation. Drums are another great instrument that there's an app for that. I see we've got people on iPads here. I would recommend, let's see if I can, I would recommend just searching musical apps. There's one called Drum Jam, which is very easy to play. It's one that you can interface with the grandkids if they have that kind of thing too. So you have a connection maybe to family members. And probably the most impressive piece of software that I've seen in my day is a free one called Garageband that Apple makes. It's a recording studio, but really the instruments that are on there are beautiful. They're grand pianos. I mean, you play, I have a sample in particular right here, but this is a this is a Steinway piano that I'm playing here. I don't know if at least it's the sound of a. I don't have a Steinway piano. This is the sound of a Steinway piano, but it has 31 microphones on that one note of the Steinway. They sampled it and put it all on this one key right here, which I think is just a fantastic opportunity. You could have a Busendorfer in your lap on an iPad rather than spending $350,000 to have one in your living room. Like the age and era that we live in. I just hope that people are looking at the technology and going back to learning an instrument, if saxophone or things like that, wherever something. The age of YouTube. Like you could even like learning to play saxophone, as a 70-year-old or something like that. You could Google search that, and I bet you're going to find at least a dozen videos related to exactly what you're looking for. So I hope that the enriching experiences that music can provide just inspire you to make that Google search. Like go ahead and buy that $30 ukulele. Maybe even buy one for a friend so that you guys can learn together, or get a little collection of them for all the grandkids for Christmas or something. Make sure also to get a tuner. They're about $20. They clip on the top. So let's see if I sing a note, if it'll try to tune my voice. Um, All right, I was almost singing an F sharp, but these clip-on tuners are, man, a life changer compared to things. You clip this onto your ukulele, you're out $50 for maybe a lifetime of enjoyment in a short amount of time. You're going to be in the beach on Hawaii. You're going to be hanging out with your friends. I actually got ukuleles for two of my grandparents. My grandfather has since passed, Louis Moran II. But but yeah, they were looking at YouTube videos of Hawaii and playing their songs and pretending they were on the beach during the pandemic. So yeah, it's been an interesting wild ride, this pandemic, but it certainly has shown us that technology is at our fingertips, and I hope nothing holds people back at any age of getting full advantage of it. So Ben, I hope that answers a little bit. There's other groups too. This picture here. Oh, I got to bring her to the front. Come to the front, please. This is Leona, and I should have had a better picture to show about what's going on in this, but it's such a cool photo.
Louis, we can only see you
Oh, I'm
in
sorry about
the
that.
photo.
Here she is.
There you go.
Thank you for the heads up, Lynn. This is from a group that they call intergenerational. And at a lot of assisted living facilities, they've been encouraging, or music therapists and activity directors have been encouraging groups that bring in people that would be grandkid age. So we had a friend, her name was Gretchen Malinowski, and she spearheaded this program in Kalamazoo. And there would oftentimes be 20 kids engaging in music in a circle, and then an outside circle of people from the assisted living facility, and all of these interactions that would happen where they're dancing together, singing together, making new friends, and it's just a beautiful thing. You can see the wins in that for both sides of the intergenerational spectrum. The young kids, it was just a great opportunity for them to see people and to get to know that kind of place and to respect their elders and to learn from them. And then, of course, the residents of the facility. Most, if they're in that group, they love to squeeze the babies, so they bring them around too. I thought, okay, we have one question. Shout out Ruth. What software do you use for recording? I use a program called Logic Pro. And this is a great piece of software if you're into music and into recording and own an Apple. I would highly recommend it for all of the things it comes with. But it is basically like the big daddy to GarageBand, because GarageBand is also made by Apple. And GarageBand is free. So you can't go wrong with free, and has many awesome things about it. I've just got a beefed up version of Logic, which I've used for years. Let me get the formatting out of the way. All right, it looks like all the questions for now. I thought we would take a quick minute. This video is about 5 minutes, and some of you may have seen it, but this speaks to the neurological connections that music strums, if you will, when it enters our brain. And we have found that if you think of the brain as two hemispheres, we've got the right and the left, and we often think, my left side of the brain is like my analytical side, and my right side maybe a little more creative. Well, right in the middle, if you had the two lobes together, right in the middle of the brain are where our emotions and our memories are kept. And believe it or not, our emotions and our memories are right next to each other, touching. I won't get. We could talk about the big names, the amygdala and the hippocampus, but these two pieces of neural anatomy, our memories are deeply tied to our emotions, and this is true of things that we find very, very sad. So I can think of a friend's funeral, and when I hear a song that was played at the service, it it brings up a response in myself that is very emotional. The memories and that difficult emotion, or maybe the music that we dance to our significant other on our wedding night, our first dance. These extremely happy emotions, they trigger each other. Parts of the brain that are touching and near each other are it's part of that human adaptation. They're deeply tied. So music and emotion. And I just thought I would show this. This might be one. This is a very popular video, but I just love it. So I think I'll pull it up and screen share it just so I can make sure that it looks nice. Alrighty. Okay, where are you? My 3-year-old sounds like they're coming downstairs, so don't mind him if you see him. And I think if we go theater mode. All right, does that look nice on your screen, Lynn?
Yeah.
Looks okay? All right, I'm going to go ahead and hit play, and I'm just going to run and make sure this guy's okay while we do it.
I have one resident that barely opened her eyes. She didn't respond. As much as I tried, I knew her for 2 years. No matter what I tried, massage wouldn't work, nothing worked. But when we got introduced to the iPods and the family told me the things that she liked, it was amazing once we put the iPod on her. She started shaking her feet. She started moving her head. Her son was just amazed. Okay, can we stop? Because now I'm getting all I'm seeing her all over again.
Hi, Papa. Hi, Papa.
Huh?
How you doing?
I'm all right. I'm fine. Wait.
Who am I?
I don't know. Wait a minute. I don't know.
Okay, it's Cherry. How long has he been in the nursing home? Approximately 10 years. He was having seizures, and my mother couldn't handle him at home. Of course, it affected me greatly because he was always, fun-loving, singing, every occasion he would come out with a song, no matter where he was. I remember as a child, he used to walk us down the street, me and my brother, and he would stop and do Singing in the Rain. He would have us jumping and swinging around poles. He was, he was good. He was always into music, always loved singing, dancing.
His name is Henry Dreyer.
Uh-huh.
And I'm looking more or less for religious music for him.
Okay.
Because he enjoys music and he always quoting the Bible. So I'd rather have that for him.
We first see Henry inert, maybe depressed, unresponsive, and almost unalive.
Henry.
Yeah?
Henry.
Yes, y'all.
I found your music. You want your music now?
What do you want me?
Let's try your music, okay? And then you tell me if it's too loud or not.
Then he is given an iPod containing, we know, his favorite music. And immediately he lights up. His face assumes expression, his eyes open wide. He starts to sing and to rock and to move his arms, and he's being animated by the music.
And he used to always sit on the unit with his head like this. He didn't really talk to much people. And then when I introduced the music to him, this is his reaction ever since.
The philosopher Kant once called music the quickening art, and Henry is being quickened, he's being brought to life.
Yeah?
I'm going to take the music for 1 second, okay? Just to ask you a few questions. Okay? I'm going to give it back to you.
Uh-huh.
Okay.
The effect of this doesn't stop, because when the headphones are taken off, Henry, normally mute and virtually unable to answer the simplest yes or no questions, is quite voluble.
Henry,
Yeah?
Do you like the iPod? Do you like the music you're hearing?
I love when he just says, yeah.
Yes.
Tell me about your music.
Well, I don't have one. I mean,
Do you like music?
yeah, I'm crazy about music. You play beautiful music, beautiful sound,
Did you
beautiful.
did you play music when you were you did you like music when you were young?
Yes, yes, I went to big dances and things.
What was your favorite music when you were young?
Well, I guess, well, Cab Calloway was my number one band guy I liked. They did the holy, the holly, the hilly, the holy, the milly, the holly, the ah.
Yeah, what's your favorite Cab Calloway song?
Oh, I'll be home there for Christmas. Oh, you can count and plan on me with plenty of snow, mistletoe, present wrapped around your tree. Ow!
So, in some sense, Henry is restored to himself. He has remembered who he is, and he's reacquired his identity for a while.
So I just thought we would, cut the clip there, but this is a response. I mean, obviously, we're a ways off from, maybe being there, but I've often thought I hope a music therapist has my back when I'm in need, whatever that need might be. I can think of a lot of situations where I would, but yeah, just seeing Henry's response, the way he lights up, and all of a sudden there's a conversation happening. He's up, he's looking in the direction of the person speaking of him. He's kind of like, you can see that personality coming out of like, oh, I don't know, don't take my headphones, gal. Like all of a sudden he's like, don't do that. Like you can kind of get this. I like the way Dr. Sachs put it there, is that he's you know during that time, he's effectively restored a bit of who he is, and and you know how he was from the perspective of his loved ones, of course. Any questions or comments on Henry? I don't have any other videos to show. I thought we would engage out here, but I did, however. Let's see if I can share this and make it large. I'm just going to put our presentation down for a second. I'll just share my whole computer, and I'm going to enhance this size. Hopefully that's something that we can see. So I just typed in ukulele chords happy birthday. I wonder if this might be clearer. I see glasses coming out, and I know that like maybe this isn't maybe this isn't it. So let's go ahead and go like this. Sometimes this, does that look clearer, Lynn?
Yes.
Okay, cool. So I just typed in ukulele chords happy birthday. So I'm going to now. I should preface: the internet is a dangerous place, and I can't be held responsible for whatever weird advertisement might pop out. Although I do pay for things to not have advertisements. So you can take a look at this right here. Can you see my cursor, the little pointer finger?
Yes.
Okay, great. And it shows you the ukulele with the strings going down, and this yellow dot here is where you put one finger to get you started to play Happy Birthday. And then there's a triangle down here for the G7. So, and it's got the color-coded hands, which finger goes where. And then for $30, you are playing Happy Birthday to, your sister or your niece or granddaughter or nephew, and it's just a very easy experience. And ukuleles are really great for people that might have pain from arthritis or might have, different challenges with their hand. How about, does somebody have, let's see if we can try to stump Google. Is there a favorite song that you, if you could sing it, you would love to sing it? And go ahead and type it in the chat or just say it out loud too. Anybody?
But yesterday,
Yesterday. Oh, that's definitely got some chords in it. So, after you've been at this for like a little while and you're looking to the Lennon and McCartney and your soul, we'll look towards something like Yesterday. And you can see already for free, I have at
Yes.
least 12 different people's arrangement of Yesterday for ukulele.
Yes.
I mean, why would we not use this in this technology at our literal fingertips? I will say this one that I clicked on first, it is in the key of F. So shout out to this person for being, accurate to the Beatles version. But yeah, so we've got. If I could, let's see if I can get the guitar going. I know this isn't a ukulele, but there are some similarities. Maybe I've wanted to learn this song for a while. Anybody that's seen the new Beatles documentary on Disney Channel, hello. Yesterday, all my troubles seem so far away. Now it looks as though they're here to stay. Oh, I believe in yesterday. I had to, I'm sorry. Paul McCartney. So those would sound beautiful on Yesterday. So now just up here, maybe reading those little dots and everything and where to put your fingers isn't what you're going to do. Well, I'm going to come up here and I'm going to click on videos. And looks like we've got a 14-minute lesson you can take on how to play ukulele or Yesterday on the ukulele. 1, 2, 3, 4, 5, 6, 7, 8. I could keep counting, but we're up to 10 people that would love to teach you from their YouTube videos how to play how to play Yesterday on the ukulele. It's just that this is just the age to be interested in something. Maybe if we want to learn everything, how to play saxophone, how to play guitar, how to play drum set. There's a woman that I follow. I believe she's 72. She's called the Rockin Granny. And I follow her. She learned how to play. She played percussion in her younger years, but then started playing the drum set somewhat later in life. And now she's just playing AC/DC. It's like, bow, ba-da-da, ba-da-da. She's pointing sticks at the camera and stuff, and talk about second life. You know what I mean? Like the Rockin Granny has a huge following of people, so that's almost like third life because she plays the drums for the second, and now she's like an internet sensation for the third. So technology, it's just really got us a good opportunity these days, and I only see that getting bigger and bigger. It's like I mentioned Star Trek earlier. It seemed, weird to think of the holodeck where they could be transported to what felt like a desert beach or something like that, or a sunny, sandy beach. But here we are nowadays, and with the age of like virtual reality coming in, and the kids, I'm already catching myself being like, kids these days and their music and their social media and everything like that. But man, they are really leading the charge quickly. They're going to get us into things that we can only imagine in the next 10, 20 years. So, yeah, I don't know if there's any other questions, but I thought that this could be an opportunity to share a little bit about what I do as a music therapist in juvenile justice. Yeah. So I love the things that we've been talking about, and I've often thought that when Jimi Hendrix and Bob Dylan and the Beatles and the Rolling Stones are like the music of choice in assisted living, I think I might transition over so that we can just rock out every day. I might move from working with young people to working with people so that we could just play that music all the time. Something that I didn't mention, by the way, is They say the music of our 20s is the music that is most stimulating for our memories. That kind of makes sense. 20s is when we start making independent. Hey, welcome to the group, Ralph and Linda Fairbanks. Ladies and gentlemen, Ralph and Linda Fairbanks.
I have a comment,
Please.
maybe a question is, have you done any work with Helen DeVos Children's Hospital in their music therapy program?
Right. I have not personally done work with them over there, although I would be willing to bet that I've worked with music therapists that are employed there. Let's take a quick little Google search. Helen DeVos music therapy. Oh, Spectrum Health, yes. Yes, I am having trouble remembering her married name. Her name was Erin Bristol back in the day, but she was more on the neurological rehab side more than the children's side. But she actually started that Spectrum Health through Helen DeVos program over there for helping people with Parkinson's, traumatic brain injury, and stroke, to help rebuild. But I really admire there's a lot of people a lot of music therapists that want to work in the hospital setting. If I'm just going to be frank and honest with you, Ralph, there's a lot of music therapists that are like, they start when they're in their freshman year and they're like, this is where I want to be by the time I'm out there. So the demand is pretty high, and I'm not saying that would push me away, but there's almost no demand to work with my kids in juvenile justice. And I've already seen them get left behind academically, get left behind emotionally, get left behind from just general opportunities in life that can maybe even help them. So I particularly feel like a vocational duty to stick with it. I've been working in juvenile justice for 14 years now, and I just try to get more passionate every year. That's my goal, especially for the fact that, the demand and the skill set, like, I have to be able to come into work and have people tell me some things, like my own students tell me some things that I know they don't mean, but are kind of hard to hear sometimes, like, or for example, I don't know, maybe you noticed while I was playing the piano thing, but I was born with two less fingers in the middle. I don't know if there's any Grey's Anatomy fans, but there was an episode on Grey's Anatomy that very, very it described the best that I've ever heard about what happened to me. It was anyway, but it's a difference that I've always had all my life, and so I'll have kids that'll like instantly like latch onto that when I'm meeting for them for the first time, and I love that. I've grown to love these different kinds of things because then they're giving me the door to talk about our personal differences. And then all of a sudden I'm like, man, well, what makes you different? What makes you different and stronger because of that difference? Because I will describe how, like, my differences have made me stronger. I was a bit embarrassed and maybe a bit shy about it when I was a kid, but overcoming that challenge has given me the confidence to just be here on a Zoom with 35 people and showing my hand, and that kind of thing. I will say I had a supportive fam too, which not all of my kids have, but I try to be that support for them. Oh, speaking of support.
Okay, thank you.
Sure, sure.
Louis, how do your students come to you? Is it, I worked in education, and so we had the IEP process, or are they incarcerated, or how do you get with these kids?
I'm glad that you've asked. And juvenile justice is not what it was 20 years ago. Let me just get. If you could go upstairs and do it, I'm going to make you some lunch in a little bit. And you can pick anything you want and I'll make it. You go upstairs and think about it, okay? Or play with Legos. Okay, you can take it up. But I'm going to change my mind if you don't go now. And we're off. So kids come into the juvenile justice system in a little bit of a different it can be from a number of different channels. So typically, when people think juvenile justice, they think juvenile home. And as much as I don't like the comparison, it's really in our minds as kid jail.
Yeah.
And that honestly wasn't far from the truth 20, 30 years ago. It was kids coming to a building, they did something, and they have to be in a building until a court date. It literally is just to wait for them to go to court and then things to be decided. While that still is the situation in adjudicated youth, because they're not juvenile delinquents, we don't put labels on them. The world has put plenty of labels, and now it's my job to help them remove the ones they don't want. So we're not trying to add any by saying like juvenile delinquent. Behavior is delinquent. Humans are not. Things humans do, sure, but not them as a person. So working with them now, it's much more of a treatment oriented thing. I serve Allegan Youth Home, and I remember starting with them about 10 years to the day ago, and it struck me their goal, their mission, is for the youth that are under their care to leave that building, whatever the court decides, to leave that building stronger than when they came in. And they go about that. I mean, they're physically stronger. There's like juvie fitness, and it's intense workouts. Um, Smarter and self-sufficiency. They have Allegan Youth Home has one of the most impressive community gardens that they keep up. Their food that they cook is excellent there, but much of their food when it's in season comes right from their garden. The onions, the tomatoes, the peppers, the zucchini, um, the lettuce, the kale, the carrots, the potatoes. They're always growing and cooking. So, and also leaving stronger emotionally with treatment services that they provide, like music therapy.
I like one of these. I like.
Uh-oh. Don't lose this one. Hey, you gotta go upstairs so Dada can work. All right. Thank you. All right.
So do you work with them individually or in groups, or do you determine that, whether
Sure.
you have kids that would
Well,
work well together?
not to get I don't want to get like to like the branches of how music therapy is applied,
Right.
but well, I mean, just because I don't want it to be, I want to make sure this all stays relative and everything. But imagine the kids that are there on detention. So that's one unit that we serve. But then oftentimes there's a treatment unit. These are kids that are usually like, they're lucky to go to a treatment unit because they could have been in the adult system. So those kids are often in programs for 8 months or more. So you've got the justice part, average stay 2 weeks. The treatment part, average stay 8 months. And then you've got the other school side where kids will come to the juvenile home, probation and the courts say, you have to go to school here, but you can go home at night. So that's like another step to their own independence, is like, it's your responsibility to come back to juvenile home, or we're just going to bring you and you're going to go to the detention unit. So it gets the parents involved, but it increases their supports that they can get from the community to not be in what we all think of as kid jail and whatnot. And then you can think of, well, they want to keep them there for the school day, but from 5 to 11 p.m. is when they're really having their problems at night, when they decide to go out when they shouldn't. So they'll have after school programs that go late into the night. Not 11 o'clock, but like 8:30 or 9 o'clock is not uncommon. So there's all these community programs that are really trying to keep the kids out of the detention realm of things or to receive the treatment. And there's also the school side aspects of things, which I'll tell you. All right, 1 second. sorry about that. Do not be alarmed. Somebody decided to get into their mom's arts and crafts area and knocked over a bunch of beads. I don't know why he's crying when he made it all difficult, but hey, I don't think he's going to come back. So all of these different juvenile justice type settings and music therapy is applied in all of them.
Oh.
So kind of an interesting, so we're in the long-term treatment, the stress management and anxiety management in detention. And we keep data in a number of different ways to see if music therapy is effective. So, excuse me, I ran up those stairs. Also, Lynn, this is the reason I didn't contact you back. I did get COVID from my lovely students. So every once in a while I take a flight of stairs and I'm like, I didn't have bad symptoms or anything like that, but that stuff is no joke. So I'm glad we're out here virtual. Whew. But getting back to the matter at hand, I thought I would introduce two of my colleagues. I'm really proud of some of the data that we keep in the educational side of things. So this cool dude right here is Mr. Mark Wentworth. He's the science teacher. And we'll be collaborating tomorrow on, we're talking about different types of clouds in earth science. And we're also talking about inequalities, so greater than or less than, in algebra. And there are 5 science classes, and all 5 of those classes receive music therapy every Thursday. So every Thursday for the whole school year means that 20%, so 20, 40, 60, 80, 100, one of those days as music therapy means 20% of the music or of the science taught in our building is taught with music supports. So we will take things like the cell cycle, and he sends me his lesson plan, and I turn these into music that the kids can use to memorize the facts. And same thing with our algebra teacher, Mrs. Pagano. So we might be learning about angles and lines. So we might be say, a line is straight and extends without end. A ray is straight but only one direction. 2 rays with the same endpoint form an angle. Drama in my face, but I ain't finna get tangled. We're always trying to reduce the drama town. So I thought I would play a couple examples of what we do here for music therapy. Let's see. And I see that our time is somewhat limited, so why don't we have you guys vote? Would you like to hear us? And these are just from last week. When I play examples, I like them to be current so you guys can feel like you're like not even a week out of things. So last week we did the layers of the earth in earth science. So think of the crust, the mantle, the core. Or would you like to learn the order of operations from one of our students, which is parentheses, exponents, multiply, divide, add, then subtract from the left to the right. So would you want to learn math or science? And anybody who votes, you get the full vote. This is not democratic. First person. Science.
Math.
Math. All right. Okay. All righty. So I'm going to screen share this. So here is our order of operations, and this class only had one young lady in it last week. I really do like it when the group gets going. But this is a young lady that people are having challenges with. And for some reason, and we've been having the social worker come every music therapy because they don't know why she does so well in music therapy and is kind of off the walls everywhere else. So shout out to her. And here is her. Okay, sorry about that volume. I will try to I'll turn this down real quick.
Louis, we've got a black rectangle over on the left and a small black square in the middle there. The rectangle on the left.
Did it leave? Okay.
Yeah.
Okay, how about, there we go. Thank you.
Okay, good.
Perfect. All Now this is pretty intense for a math class, but this is what motivates our students musically.
Parentheses exponents, multiply, divide, add and subtract from the left to the right. Parentheses exponents, multiply, divide, add and subtract from the left to the right. If you see parentheses, you're gonna have to start with these. Next is exponents, and you know you got the expertise. Then multiplying or dividing if you need. Add and subtract from the left to right, please. Outside parentheses, the order starting over. Panamas every day in my algebra folder. I see the world around me getting colder and colder. I got these skills, you can call me a parentheses exponents, multiply, divide, add and subtract from the left to the right. Parentheses exponents, multiply, divide, add and subtract from the left to the right.
Wow.
Yep. And this is just, we get one class period to make the magic happen. You know what I mean? We get, because my commitment to the teachers is that we're not going to drag your curriculum out across several weeks. When you've got to be able to teach it in 1 hour that you have them. I'll make sure that the music not only honors that, but enhances their memory of the content. And that young lady knows this information cold. And we've also seen, I'll pull up just a quick little data, and then we can take some, where did you go? Keynote. We keep data on how well our students are doing. So we'll give them a pretest at the beginning of class, which sees how much they learned from the lesson before on the content. So I'm looking at this pretest, and that looks like they were learning about erosion and oxidation and different kinds of things that can weather the earth around. And we give them a test after. Now, this young lady here wrote their initials very clearly, and you can see that those lines on the paper maybe are actually very straight. Just by looking at how much they care about the test they take at the end is an indication. Sometimes they write a curse word on their pretest, and that's it. You know what I mean? And I could punish them for that, or I could say, can you manage this so that we can learn something and get out and have you leave here knowing what you need to know? And then this is how we get our post-test. Students do, at least last year, did on average 40.6% better on the content that we covered in music. And we also take their mood scores at the beginning and at the end, which lets us see how much did their stress reduce. Because the higher number is the higher stress. So if they go from a 10 to a 5, it's a 50% reduction in their stress. So these kinds of, and it's their perceived stress, which is oftentimes with our students what matters the most, what they see, what they recognize. So we also took a random selection last year of, so we took 8 questions that we covered in music, and then we rolled online dice and took 8 questions on the final exam that we didn't cover in music. And students got 92% on those random questions that we covered in music on the final exam, and got a 47% on average on the content that was non-music. So just another example of using music for non-musical purposes that'll motivate my students, get them to learn what they need to know, manage their emotions and have some emotional wellness, and then we get back the next class and we try to do it all again. So
Well, there are 3 questions in the chat.
okay, let's take a look. So
can you see them?
I can. Thank you for shouting that out. I have it over here. So where did you go to school for music therapy? Great question. Shout out Western Michigan University. Whoop, whoop. Go Broncos. They have an excellent music therapy program, and it has gotten big over there. The interest in music therapy has grown, whereas I was in the introduction to music therapy class with 11 students, and last I presented, they had to have a second course added because they had 65 students in the intro to music therapy course. So it's grown just in the short time since, well, somewhat short, that I've been away. But yeah, Western Michigan University has a great program, and it's behaviorally oriented. Some music therapists operate a bit more like communication and interpretation. I really like the hard data and the science that Western gave us. So shout out to them for that. And I went there for my master's in music therapy as well. You mentioned drum jam with the grandkids through an interface. What did you mean by an interface? So there are connectivity in apps that you can find, and I believe Drum Jam is one of them, but you can collaborate in real time, with people if they have a web connected device and you have a web connected device, and you can kind of have long distance jam sessions happen. But Drum Jam is a good one. There's also a thing called Google Piano, which is actually really super interesting because do you know how if we all started singing, if you're happy and you know it, clap your hands, none of our clapping would be together on the Zoom? It's just because there's delay in everybody's internet connections. The Google Piano actually has no delay, and you can play it on your phone, so you can play little piano notes. And if you are connected with 20 different people anonymously from around the world, everybody can play this giant piano, and it's all together and sounds good in real time. So that's an interactive thing. And what I meant by interface was just you can connect with people.
Someone asked, what software do you use for recording?
Yep. And I had mentioned that I use Logic Pro, but if anybody's looking for a place to start, GarageBand. If you have it on any Apple phone or iPad already for free, explore that. It is a powerful app for free. Cool.
What led you to music therapy?
I knew when I came to college that I would like to pursue a career in music. Back then, maybe I was a little, I just wanted something that I could engage with music every day for work. So I thought I might be a music teacher, but something just felt like, I also really liked science, and I really liked the idea of psychology and counseling, and I found music therapy, and I was like, this must have been made for me, because this is really like, these are all the things I wanted out of a career, and here I am. So, yep, shout out to my music teacher at the time for introducing me to the idea of music therapy. And I took the intro class, and the rest is history. Any other questions? Keep thinking of them. I did want to mention a couple things. I know we did, I never know how time is going to flow and everything like that. But I did want to do a couple different demonstrations of how music therapists use music to cue non-musical things. So, lumped in with melody, I would also consider the idea of cadence. And a cadence is when a song ends. So if I pulled up my guitar again, and let's see. And we know the song Oh My Darling. So if I was like, oh my darling, oh my darling, oh my darling Clementine, you were lost and gone forever, oh my darling. Clementine. Yeah, if I don't end the melody, that's what the cadence is. If you don't end that, you're going to have people on the edge of their seats. They're going to be like, like somebody with autism who might have no words is going to be like, oh my, like, where is Henry? Where is Henry? And you just wait for it, and they feel that anticipation, and you reward that when they provide that communication with a cadence. We talked a little bit about rhythm with the P300 response and how effective just simple rhythms can be in organizing our gait for our walk, the heel strike, the toe roll, the push off that our feet do when they walk fits perfectly with like a country music style. So heel, roll, flick, heel, roll, flick, heel. And I actually worked with somebody with cerebral palsy, and he was averaging 20 steps with physical therapy, 20 feet of distance every time they evaluated him. He was at that time 9 years old. With music therapy, he loved country music, so we did way down yonder on the Chattahoochee. We did country songs he loved. He did 415 feet his first day of music therapy. I was an intern at the time. So the physical therapist sat me down after that and looked deep into my eyes and said, "What was that?" So, yep, that's the power of music right there. We talked about oh yeah, go ahead, Ralph.
Yeah, one other question. Is there, in helping older adults with memory issues,
Yeah.
for example, trying to learn a foreign language, is there any aspect of musical therapy that could assist a person like that?
First, I would say learning new things is great for the brain. They say use it or lose it, and they really do mean that. I mean, there's like almost like stimulating neurons, getting the literal electricity going is a very positive thing. So you mentioned language. Language comes from, let me double check. There's Wernicke's area. Okay. I just wanted to make sure, since this is being recorded, to not get this wrong. I don't work in speech and aphasia and that kind of music therapy, but the left side of our brain, inside Broca's area, Wernicke's area specifically, is where our language our speaking production comes from, the mechanics that involve it, right? So you're talking about learning a new language, right?
Mhm.
Well, the right side of our brain is where singing happens, which is why you have Brian Wilson of the Beach Boys, who you can barely tell a word that he's saying when he's speaking, but yet he's on tour playing Beach Boys music because singing comes from a different part, right? So, my recommendation of a musical application, because for people with the memory, learning something new, already good. Learning a new language, already good. That's left side of the brain. Incorporate songs that are in that new language. So Spanish songs or French songs, La Luna Toba, and all of a sudden you've got more areas of the brain activated. You're going across from left to right and right to left, back and forth, and that stimulation can be a great thing. So to answer your question, I would say if you're learning a new language, great. Try learning songs in the different language, and you're going to more than double the activity going on and
Very good. Thank you.
neurologically. Cool. Do you know any volunteer opportunities in the area of music therapy? That's a great question. There are, I don't know what might be available in your area, but I would look in special education. So, very often, and oh my gosh, like little kids, little 4-year olds with cerebral palsy that need some help and everything. Um, my wife is a music therapist, and she works in special education in Berrien County. So there's foster grandparents, and they come in and they help out groups in all sorts of different ways. Don't usually have to get involved in like the dirty parts of the job, but do get to participate in things like music therapy and to all forms of things. So I would say that's a great volunteer opportunity. Volunteering different ways at like assisted living facilities, or even just like adult recreation clubs. Like maybe there's different ways that music therapy can help there, and that's an opportunity for you to bring somebody in that sense. Yeah, I would say think of a place that you would like to be, and there's often an opportunity to work. I know hospitals are not the best place right now for volunteers just because of the international pandemic, but yeah, I would definitely say special education placements would be great. All right. If there's not any other questions, I thought we could leave on some music. Maybe "Goodbye, My Friends. It's Time to Go." And what would rhyme? That was the That was the Hasp Show.
Yeah.
Goodbye, my friends. It's time to go. Boom, 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 boom. Goodbye, my friends. Well, it's time to go. Doo, 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 doo. I hate to leave you, but I really must say goodbye, my friends. Goodbye. All right. Thank you guys so much for having me for this little music therapy deep dive, if you will.
Thank you so much.
It was such a pleasure.
We really enjoyed it.
Thank you.
Thank you
Lily, it was
so
a
much.
Great job.
privilege
Thank
to
you.
have you here today, and on behalf of everybody from HASP and people in this class, and I'm going to refer, I've already have a handful of people I want to watch the recording of this.
Great.
What a gift, and thank you for sharing your gifts with us and the world. And thanks for sharing your 3-year-old son with us too.
Oh, yeah. Yeah, we're going to, a granola bar ended up being the winner of keeping them.
Thank you
Thanks.
again.
All right. A pleasure being around. Thanks. I'll talk to you. I'll follow up by email, Lynn. And thanks for having me. Lynn's, she got me in here. So.
Thank you very much.
All right. Have a great day and keep hasping.
Yes.
Bye, Louie.
Bye.
Okay, everyone. I'm going to go close the class. Have a wonderful day. Be safe outside if you're going to be traveling. Take care.
Bye, Susan.